So let me remind everyone here in person that there are two microphones on each side. If you have questions for any of our speakers this morning, please line up at those microphones, and we welcome questions from those joining us online. If you drop in the question and answer box, we will be sure to pick them up. So moving on to the next topic of this panel discussion, wanted to check what's your ideal practical solution that you have for your own community as of today. What's the best thing that can happen for a new person, child diagnosed with the disease that you're battling for? Maybe Dorothy, you can go first and then we'll go around.
Having another approved therapy to treat PWS would be the best thing for our community right now. PWS has a multitude of symptoms, but the hallmark symptom of PWS is something called hyperphagia, which basically is the inability to ever feel full. So if you can imagine not eating for 3 days, and then you imagine yourself feeling that way with everything that comes with those feelings, agitation, exhaustion, you feel that way 7 days a week, 24 hours a day, every single day of your life, no matter how much or what you eat. If we can do something to assist in treating hyperphagia, it would be monumental for our community. And in addition to that, with all of the other symptoms, we're finding that research is telling us if one treatment, if one of these symptoms is treated, it helps with all of the other symptoms. So for example, if hyperphagia is decreased, then the anxiety level of our population will go down. A lot of the times the sleep disruption is caused by the fact that they're starving. So it can assist in proper sleep development. So for us, it's really about another treatment to help with some of the other symptoms of PWS. That would be a miracle for us.
Wonderful. Allison, what would?
Yes, for us, the biggest challenge and the biggest reward would be to have asplenia be able to be diagnosed universally for all children, to just determine if they have a functioning spleen or not. Because I'll give you a case example of another one of our patients. She was 2 years old when she first developed a high fever. Her doctor dismissed it and treated her with antibiotics. Those antibiotics did keep her alive, but in the process, she spent 8 days in the NICU at Boston Children's Hospital as the sickest child in the unit. And in the process, due to the infection that was invading her body and her body's inability to fight the infection with her missing spleen, she lost 6 of her 10 fingertips and 1 of her toes. And now she survived. She's now in 2nd grade. But she had to endure extensive physical, speech, and occupational therapy. And now she faces the questions from her peers. Well, why are your fingers different? So she has, as you said, Dorothea, the effective storytelling to share with her peers and even adults who may wonder, why is this little girl missing 6 of her 10 fingertips? Her and her parents are helping her to learn how to tell her story. So with the better detection, we can prevent outcomes like Travis, we can prevent outcomes like Grace, and give these children a chance to battle infections that any other child with a functioning spleen would be able to overcome.
Thank you. Suyuk, what's the best thing that can happen to someone new diagnosed with Gaucher or a lysosomal storage disease?
Sorry. So I think there is a need to improve the diagnosis, because currently, as I said, there is very low awareness about Gaucher or any other LSDs in India, apart from the major cities which have the centers of excellence, especially in rural areas. Even the primary healthcare providers do not have, they haven't even heard of any such disorders. So most of these patients, need to travel very far distances to other metro cities to get a diagnosis. And even after the diagnosis,
sorry to interrupt, Suyuk. So anywhere in the world, right? So if a patient today is diagnosed with a lysosomal storage disease or Gaucher, what's the best thing that that patient could hope for?
So I think, so once the patient is diagnosed, the main thing that they would be looking forward to is getting a treatment. But in India, the situation is very different because, as I said, most of the patients are receiving treatment through humanitarian programs of pharma companies. And those programs, are currently closed for any new patients, so they are not accepting any new patients. So most of the patients who are getting diagnosed now, have a very uncertain future, so they have to rely on other kinds of, fundraising sources like crowdfunding, or ask for in maybe CSR donations of corporate companies and things like that. So because, as I said, the government's support currently is limited to a one-time financial support of around 60,000 USDs, which is not enough. And yeah, so that's a challenge.
Thank you. Naveen.
I think for us, the biggest thing that can happen, the most important thing is that if somebody is diagnosed with this disease, they get a chance to understand that there is something being done about this disease. Because when we look back at our journey, there was nothing, and it really was a very scary feeling. And because the disease is just not known, not even in the clinical community. When I remember when we went to one of the doctor at a pretty big institute here in California, the one thing they said was that you are probably the first and maybe the last patient that I'll treat or look at with this disease. So that's the first thing. And of course, practically speaking, then the next thing the patient would need to understand is, okay, what can be possible as a treatment. And for this disease, we are really working hard on drug repurposing and some of the non-approved drugs as well, which hold good potential. So we're hopeful that next year or two, if we are able to get something in the clinical trial, and FDA is amenable to really look at the only safety aspect of it and not hold us to the standards that normally a drug company with millions or billions of dollars. I think that's what we're hopeful for, and in the long run, of course, we are working on gene therapy as a cure.
Great. Yeah, Sabir.
Okay. See, I think just when a patient or a parent of a patient gets a diagnosis, the biggest challenge or the biggest, I would say, issue that they face is disillusionment. They don't know, they don't understand. There's nobody to guide them. There's nobody to tell them what they should do, where they should go, what is it that needs to be done. And they suddenly feel isolated in that disease diagnosis which they have just got. And that's where I think it's very important for patient advocacy groups to step in, to give them that sense of belonging, to give them that sense of being together in that challenge which they are facing individually, but at the same time, they know that there are other parents, there are other patients which are facing the similar kind of challenges. So that's the immediate consequences, that's the immediate need which arises and which needs to be mitigated. And of course, I think in the long term, everybody is looking for a treatment. Everybody needs a cure. How do we get to that cure? How do we get there? Is something which, again, you have to keep that hope alive. You have to, not allow them to get burnt out in terms of saying, okay, nothing is possible, so let's just forget about it.
Thank you. Gautam, you're joining us on Zoom. What's the best thing that can happen to a new patient with sickle cell disease?
So I think sir said that everyone need a cure and best treatment. Regarding sickle cell disease, I must tell you that 1.4 million people are waiting for the right treatment. And this is not so much difficult. Actually, as I said, that the bone marrow transplant and gene therapy is the last option, but yet we are only depending upon the hydroxyurea treatment. So hydroxyurea, luckily, is not so much costly. It is very economic. But what we need the education to the professional, because district health officers, doctors, mostly don't know about what is the sickle cell disease and what is the treatment protocol regarding hydroxyurea. Our most of the patient can can live full life with the hydroxyurea treatment, and which is very easy because my two kids both are sickle cell disease warrior. They are taking hydroxyurea with proper doses. So 3 years before they were taking hydroxyurea with low dose, but having more and more crisis within 2 months, hospitalizing were increases. But after setting a proper dose of hydroxyurea, now since last 3 years, both are very good and performing as a normal human being. So I would like to share my message that in India or all over the world, the simplest protocol of hydroxyurea should be known by all professionals, and that will be the easy to take care each and every sickle cell patient of the world. And diagnosis, 2 3 major symptoms are there, just like a severe pain, severe anemia, and especially uh, uh, jaundice. If these three symptoms are regularly facing by the patient, then doctor should advise the sickle cell test. This is most important in rural area of India. So the diagnosis is very important because right now most of the patients, millions of the patients are waiting for the diagnosis. Once the diagnosed, then we can start a hydroxyurea treatment firstly. Then many of the patient we can save, because the early deaths are happening in India, just like in 2 year, 3 year. They are not seeing their fifth or sixth birthday. So we can save their life by educating professionals as well as the common public in India. Thank you so much.
So much, Gautam. Appreciate that comment. We have recent approvals for sickle cell disease treatments by the FDA in the US. In the next session, we have Ginger Davis speak about the situation, standard of care and options in US. It'll be great to see how that there can be some cross-border learnings there. So we have one quick question here, and then we'll close the session.
Thank you, Harsha. Dean Sir with MLD Foundation. I know you're on the clock here. So the good news is I started this session with a question, but you provided an answer. And Suyog, I'm with MLD Foundation and lysosomal disease. And my question, which I think is of interest to everybody, is how can we better create relationships between advocacy here and advocacy in India, certainly globally, but specifically here in India, to share what we know? We have a therapy that's in front of the FDA, or a PDUFA date in March. We need to get that to our Indian peers and so on. So I have an answer. I know what to do, but I'm sure others have that same question.
Yes, great question. And that's the closing question to the panel anyway. So thanks for asking that. Is what's your...
I'll make it brief. It's not, he asked the question,
Sure.
but I didn't want to make a comment.
Go ahead, Ginger.
Well, that was the question I was going to ask, but there is so much commonality between the rare diseases that you've all talked about. We have extreme fatigue. We don't have a problem with getting energy. We just don't eat when we don't feel well. One of the things in children with sickle cell, you either have splenic sequestration where your spleen swells, or it atrophies, or it has to come out because of the swelling and the inflammation. And so there's a lot of commonality in terms of how things are being treated because the education isn't there. So again, how can we work collectively, representing each of our rare disease, but collectively as a rare disease community to get improvements everywhere. And it's not just you're looking at other countries. We're having these problems right here in the US. So I look forward to collaborating with everyone.
Thank you, Ginger.
And there's a question online.
We unfortunately do not have time for that, but I'll ask, so there will be opportunity to during the networking and online conversations, but the final question for the panel is, what's your hope, wish that how US-India collaborations and cooperation can help advance, move the needle for your own community? What is your hope for future of not just US and India, but more international and cross-border collaborations engaging the rest of the world in this rare revolution? Go ahead.
Well, I would just like to say thank you to Ginger for that question because, as you said, the commonalities within our rare diseases, the fatigue, the connection with sickle cell and the spleen development, and what happens to your patient community. And the whole purpose of coming here today is to bridge those gaps, to find that commonality, because although we may only be working with, in the example of asplenia, we may only be working with a handful of patients. What do we have in common? Where can there be commonalities found in the genetic mutations? And that's at events like this, that is how the conversations start. And we continue to move forward to bring that not only to India and to the US, but globally.
Thank you, Alison. Samir, yeah, please.
Yeah, I think, the rare disease community cannot be limited to a country or to a section of the society. We are living in a global world today. We need to break these barriers which exist in terms of saying that this is for the US market or this is for the North American or the European market. We need to look at it as a global issue, a global challenge which is there, and integrate all rare disease patients for the treatment which is essential for all of them. We can't just do it in terms of saying this is going to be limited only to this part of the world. We have to break those silos or those barriers which is existing over there and integrate everybody together. So the clinical trials, the research which is happening has to be done in a global way. You have to look at the markets. You have to look at the patients all across the country. It cannot be limited to a particular section only. It can't be done like that.
Naveen?
Yeah, I think I have two thoughts on that. One is the overall diagnosis and linkage of the patients and their families to the organization, which are really pursuing this cause of advocacy. And that linkage cannot come without the full participation from clinicians all over the world, right? Because they are the conduit. Patients don't know how to connect, who's working on what, and clinicians, their awareness plays a very important role, and then playing that important role. The second thing I would say is also, going back to the point that it's a global community, right? Patients are all over. And in many cases, like when you have to run some of the experiments or when you have to run some natural history studies, you cannot rely on the old protocol of when you're trying to do that within a small geographical region. And that's what I hope for, that through this kind of forums, and we can create that awareness that dire need of doing that.
So your closing comment?
Yeah, I think so. Collaboration between the two countries is very important because the US has a very matured and a comprehensive research infrastructure when it comes to rare diseases. As we know, with the Orphan Drug Act, there have been so many therapies that have been developed for rare diseases. So this knowledge sharing and information sharing will really help more therapies to be developed for LSDs as well as other rare diseases all over the world. And I think also the point of clinical trials that was discussed earlier. So most of the clinical trials for rare diseases are concentrated either in the US or in Europe. And there are very few trials that are conducted in India for rare diseases, even, despite having a large population and, very heterogeneous population. So which can in fact be beneficial for the researchers. So I think those 2 points, if they are taken care of, then that can be really beneficial to the community.
Thank you, Soyog. Last year, we celebrated the 30th anniversary of the first orphan drug approved. That was for Gaucher in '92. And you are a recipient of that treatment. So congratulations and thank you for being here in this inaugural summit.
Thank you.
Dorothea, your closing comments?
I couldn't agree more. What we've done as an organization to start is we are part of a larger worldwide organization, which is the International Prader-Willi Syndrome Association. And we collaborate with them on a regular basis. We are doing our joint conference in Arizona in 2025. So as a Prader-Willi community, we're trying to bridge that gap. But it seems to me that when you have two of the most populous countries in the world working together, it would just make more sense for cross collaboration. It seems that when you have a population where a rare disease is considered one out of every 500 or 500,000 rare diseases versus where in the US it's 200,000, we have a problem with, getting people in clinical trials because we have such a much smaller population. So I think that there is an opportunity for us to maybe conduct studies in the US and in India at the same time, and being able to combine that data. I'd also like to see the FDA be able to use that data and rely on it as if it were in the United States. I think that that's policy that really needs to be looked at here in the United States. I know that they do it every once in a while for trials that are going on in Europe, and I think we need to open it up to the rest of the world.
Thank you so much. That was a great closing comment. From my side, just listening to all the panelists this morning, it's very clear that the recent visit by the FDA commissioner to India as the pharmacy of the world, pointing out the need for affordable and more accessible therapeutic options, as well as what Dorothy just pointed out in making sure the treatments that are approved by the FDA are automatically approved in India also by the Indian regulators if it is an orphan drug. And hence, that's the one of the key takeaways of this panel is how can we work together to ensure more treatments that are being developed are inclusive in also getting those treatments to India and other countries. Gautam, you will have the final word.
Two things are there, sir. In sickle cell disease, we need one is to stop the new birth of sickle cell disease patient, and second, those who are living with the sickle cell disease, we want for them a better quality of life. For those two things, I must request to the all over the world that please support for the community screening with the diagnosis, and second, for this to improve the system, and also please research some newer medicines or whatever therapy, because we are right now only depend upon the hydroxyurea. So I must request to the all researchers that millions of the people suffering with sickle cell disease are waiting for your research so that they can see the beautiful world. So this is my request. Thank you so much.
Thank you. Please help me in thanking the speakers this morning. So before we break out for networking, I would request all of you to stand up with this souvenir in helping us inaugurate the summit holding, and our photographer will capture this moment.